Start by sanitizing your hands thoroughly with an alcohol rub, then don fresh, sterile nitrile gloves.
Gather all necessary sterile equipment on a disinfected tray, and verify that packaging is intact.
Check the medication ampoule against the patient chart for correct dosage and expiration date. Protect your fingers with sterile gauze and snap the neck of the glass ampoule away from your body.
Draw the prescribed volume using a filter needle, ensuring the needle tip remains submerged in liquid.
Tap to release trapped air bubbles. Prime the line and attach a fresh 23-gauge safety needle.
Expose the shoulder and ensure the patient is seated comfortably with their arm completely relaxed.
Place 2 finger widths below the bone. The target site sits centered in the inverted triangle.
Cleanse the site with 70% alcohol, moving outward in expanding circular patterns.
Allow the alcohol to air dry completely. Hold the skin taut across the muscle, using your non-dominant hand to stabilize the site.
Insert the needle smoothly and swiftly, like a dart, at a strict 90-degree angle.
Inject the medication steadily at a rate of 10 seconds per milliliter to minimize tissue discomfort.
Withdraw the needle rapidly at 90 degrees and apply light pressure with dry, sterile gauze.
Dispose of the used syringe immediately into a safety sharps container without recapping. Apply a small sterile bandage. Instruct the patient to keep their arm relaxed.
Doff gloves, sanitize your hands, and document the procedure accurately. Subscribe for more